Hello, this is Nancy Harvey from the Allscripts optimization team. This video was compiled for those of you who are contemplating a healthcare IT change. Let's use your data to better understand your current state so that you can appropriately make decisions on how to implement your new practice management system. The information that we're going to review today is a small sample of the full analysis that you will be provided. The full analysis contains over 40 key efficiency metrics. How many times have you implemented new technology, but then implemented it very similarly to how you had the old technology configured? Let's use your data to give you better visibility into your current state so that we can really drive implementation decisions based upon data, the new currency. This analysis is going to include 12 to 24 months of your practice data, starting from the second that the patient requested the appointment. How long was that in between when they held the appointment and when it was originally scheduled? Who was it scheduled with? Who was it referred by? Which CPTs were billed? How do different insurance carriers reimburse for the exact same things? And then how are we seeing different trends around that data? What days of the week were those scheduled? Which providers were they scheduled with? Those 40 different key efficiency metrics are going to provide an impactful presentation for you to be able to make decisions based upon. This first analysis is going to provide you with completed visits for your entire practice, as well as completed visits at a per provider level by month and per week. This will give you actionable data to understand the ebbs and flows of the seasonality for this particular provider to appropriately configure templates based upon those trends. The next analysis takes a deeper dive into that actual demand. And we're taking a look at, again, for your entire practice, what types of appointments are we seeing when and what days of the week. But on a per provider basis, we're able to see per week how many new patients are they seeing. In this example, how many knee brace appointments, home health certifications, therapy visits. We're then breaking it down further by day of week and making recommendations based upon the minimum number of those appointments that you've had and the maximum number of appointments that you've had of those types of visits on that day. Because think of it this way, your doctor's templates are typically built based upon emotion. They may have an allocation for 20 new patients in the day, but the data says the most they've ever had is 11. So why would we hold 20 new patient slots when the most you've ever had, even in the busiest time, was 11? This gives us the ability to have true data to present to our providers when we're going to make some changes. Why not go ahead and make these changes based upon data and not emotion? We're also taking a look at how far in advance are your appointments changing, rescheduling, or no-showing, and what are the most common reasons for those changes. What we want to be able to do is plan accordingly. Does it mean that you need to tweak some of your patient engagement tools and how far in advance you're notifying patients of those reminders? Because maybe people are canceling when they're getting those reminders and then you don't have enough demand to backfill those now available appointments. So by understanding the trends, we can configure your new practice management environment accordingly. Lastly, we're taking a look at per provider. When are they seeing the most changes in their appointments? So when are those cancellations, reschedules, and no-shows happening? Because if we can identify that on Tuesdays at 9 o'clock, there is a high propensity of those changes to happen, then maybe we might build those templates different in the new environment. Thank you very much for your time today. If you would like to have an overview of the entire analysis, please reach back out to your Allscripts executive that forwarded this video to you. I would be happy to spend one-on-one time with you to talk further about how this analysis can benefit your practice.